everyone, welcome to NHS Starter Pack by BritakMedics. We couldn't record these 3 slides, so I'm just going to play these before the actual recorded session. I hope it helps you all. Good luck.
Okay, so let's just discuss some pros and cons of having a shared apartment or an entire apartment. Shared apartment would be actually you'll be having one room, and the living room and the washroom and the kitchen and everything else the house has or the apartment has would be shared with the land owner. In a shared apartment or in an entire apartment, both ways you have to sign a tenancy agreement with the landowner. Mostly the person who will be living with you would be having a living policy that obviously they can say that their dog might just come into your room and you have to like wash the dishes each time like you have your food. You know, like everyone has his or her own terms and conditions that you need to comply with. Obviously, so sometimes people who are actually like try to like when they like to just live their own life like the way they want, so they might have some problems living with the landowner. So sometimes they comply, sometimes they do not. But anyways, a shared apartment would most probably be having a fixed rent. It would be somewhere about 500, 600 pounds, and it would most of the times it does include bills as well. And the council bill would definitely be under the name of the landowner and not yourself. So I think so everything is included in that package if you just go for a shared apartment with anyone. And it's obviously I would say like obviously getting one room is cheaper than like having an entire apartment. But if you prefer to like keep your privacy, go for entire apartment, so obviously you would be more easy. Like you have the keys to the main door, you can come whenever you want. It would be some people just prefer that. Some people still have an issue of sharing the washroom, so they would prefer to go for an entire apartment just because they don't have to share the washroom with anyone else. That's one of the reasons that I've gathered over the months that people would actually go for an entire apartment as compared to shared one. But in that case, just because you are like having the responsibility of an entire apartment, you would be needing to pay the council tax and the bills as well. That would include electricity and gas bills. Recently, the bills of the gas has been surged just because of the Ukraine war going on. But anyways, that's just another topic to be discussed probably somewhere in the future. The council tax, I would like to show some light over it. Council tax depends on where you actually live. So if you're living in a city center or some place where it's really has it's really busy, you're gonna have houses who have a higher pay band. For example, like we have bands A, B, C, D, things like that. So A band is gonna be the cheapest. You're gonna pay like probably 60 pounds or 80 pounds a month of council tax, and as you go higher band you have to pay more tax. So it all depends where you're living. So different places have different council taxes and bills accordingly. Okay, so moving to the next point, everyone who comes here is obviously going to be paid, and we need a bank account for that. So the time you move in, you're going to have some trouble with getting a physical bank account just because it's not really easy for people to get a bank account opened in the very first month. And obviously you're going to be paid the very first month. So what people do is that mostly people just go for a digital bank account, which is basically, just an online application that you can download in your phone and just somehow give your identification to them, and they can open your account and you can get your sort code and account number and get your salary accredited to that account. So what you would guys be needing for a digital bank account would be just your passport, visa. Probably some people do need some self-identification. Would be a short video that the application would requiring you guys to just make a video of yourself and just say, hi, my name is Hamza, I just want to open an account, and it would all be dealt with. So a couple of options that you'll be having would be opening an account with Revolut, Wise, or Remitly. Remitly is one of those apps which actually can allow you to have very cheap rates if you guys want to send some money back home. So these are one of the options that you can actually go, and you can just get a bank account in like just one day or less, a couple of hours. So it's really easy if you want to get your first salary accredited to this digital bank account But I think so that if you don't go for that, you can just have two salaries together in the physical bank account the next month. But obviously I would say that you should actually have a digital bank account as well as physical bank account, because it doesn't hurt having two bank accounts. Anyways, so a physical bank account is the one which would be a little bit hard to get in the first place, just because first of all, you come here, you will have to sort out your BRP, you have to collect your BRP, and then you have to prove your residential address. To prove your residential address, you need a letter from HMRC, or probably a council tax under your name, or something, bills under your name, okay, and or any credit statement, something, things like that. So obviously, when you just move in the first month, you're not going to have any of these things. So it's really hard for you to get a physical bank account the first month, but it's not that difficult. You can have it the next month or probably the third month. I just got my physical bank account this week in Barclays. So they just, most of them just requires 2-3 things. That would be identity, most probably your passport, a visa in it, a visa in Vignette, just to see how long are you going to stay over there. A BRP is one of the things that you get a card in here as a resident permit. It shows that you're eligible to work, and it also has your national insurance number on that. So proof of residential, as I've told you, that it's going to be your taxes, statements, credit statements, your other bank accounts that you have, or your stuff like that. And some people do ask about your source of income, just because obviously you're going to fill in that application form that what's your source of income, and it would definitely be NHS. So a couple of options that I would say is Barclays, HSBC, and Bank of Scotland, etc. So it's all up to you what you want to guys get. Okay, and lastly, I would just briefly tell about credit score. So credit score is one of those things that you actually have in UK, probably elsewhere as well. It is basically a numerical value somewhere between 350 to 800, and it basically shows your credit worthiness, like how good are you to actually give someone pay back the debts. Okay, so multiple credit bureaus over here in England or in Scotland, like Experian and TransUnion, actually gather data and analyze your credit reports and see how good are you to pay your debts back, and they give you a score. And the higher the score, obviously it would be more better for you to actually, in case, for example, in future you have to borrow something from a bank, or like get a mortgage or things like that. It's going to help you with that. But this thing is going to be like, not very soon, not in the first month. So probably you guys have to wait a couple of months before you actually can apply for Experian or TransUnion or get your credit scores going on. So payroll and tax codes. So any person who just starts your NHS job would be having a tax code, and it mostly would be an emergency tax code. So government.uk website says that anyone who has just recently changed his job, or has just started a new job in NHS or anywhere else in UK, they would be having an emergency tax code, which mostly just go with 0T, M1, or just M1. It all depends. So emergency tax code is the one in which HMRC does not actually know what tax code that you have and how much tax you need to pay. So just a temporary tax code that applies to each and every one, and the very next month, or just like in 2 months, it will get reverted to the correct tax code. And the correct tax code would be S1257L. That means that you guys would be having £12,570 annual income that would be tax free, and the salary before beyond that would be taxed. So I would say that when you guys like get your pay slips, first pay slips, you should actually see what tax code that we have that on, and most probably it would be MNE tax code, and you should just call HMRC and just let them know that it's not the tax code is not right, and you need to change it to the right one. And obviously they do know that what your minimum salary and maximum salary is for the annual year, and they would just do it on their own. But if you just want to do it as quickly as possible, just call them the very day you get your salary slip. So I would just like to sorry, can you just please go to the next previous slide, please? Yeah, so just one last point over here is getting paid for shadowing period. So I would just like also mention this point in my slide next as well. But sometimes I think so some trusts do not actually pay you for shadowing period. So just confirm your trust when you start a job, that when you'll be having a sharing period for like a couple of weeks, like 2 weeks to 4 weeks, are they gonna pay you for that or not? Just because it's gonna be a big amount, so I just don't want anyone to lose some money. Anyways, I'll just talk about it afterwards as well. So, what is locum, and what I would say more about taxes? So, locum is a duty that you do as an extra duty, and that is not under your contract, and you work some extra hours just to be paid some extra money. So mostly the hourly rate for locums would be somewhere around 30 to 60 pounds per hour, depending on the specialty. For example, if you are employed in a ward or some subacute area, they will be having some low rates. And if you are like going for a job in a higher specialty, or you have a higher band, or I would say like if you're working in emergency department where you have like more hectic jobs, you will be getting a higher rate, would be about 50 or 60 pounds per hour. But this is the gross rate. This is the actual amount that you will be paid, but it needs to be taxed. So what happens is that most of the trusts will actually give you an additional payroll number in addition to the payroll number that you already have for your basic pay, if you're getting my point. So the additional payroll number will actually, will have higher tax rates as compared to your initial payroll number. So it's going to be 40%, I would say. And if you just deduct 40% and about 9% rate for the pension and insurance, it will give you the net rate. So it's like about 40 to 50% is deducted. Anyways, still like a lot of people actually go for locum just because somehow it can give you easily it can give you 200 pounds a night if you just go for locum. So that's actually a good take pay home. So additional payroll number, I would say that some trusts like Hira's trust, like where he is working in NHS Air, they actually do give the locum pay in the very same payroll number as the the initial payroll number. So I don't know, like most of people have actually different payroll numbers, just like myself has a different payroll number. But I think so that's all depends on the trust. But anyways, I think so the tax deduction is same, even you have a one payroll number or just two payroll numbers for locum. So movies telling you something about tax bracket, I would say tax bracket is a technique, is a criteria, or I would say is a way where actually how UK government actually tax you for the amount you're getting in a year. So personal allowance is the amount that you actually have tax free in an entire 365 days. So the initial amount, £12,570 earning annual year, is going to be tax free. The basic rate is going to be 20%, which would be 12,571 to 5270. So that's the amount that if you're actually getting a year, you'll be paying 20% salary tax on that. And if you somehow do a lot of locums and your pay goes beyond 50,000 to 71 up to 150,000 pounds a month, you'll be paying a higher rate that would be around 40%. But I would say that this rate is actually exclusive of the pension and the national insurance that you're gonna pay, just because that's different part. And every time you're gonna be paid, you're gonna be paying national insurance and your pension as well. But these are just the rates that you'll be getting on if you have been working more hours. So what is national insurance number? So national insurance number, just like many countries, like they allot you a specific number that shows that just it's a social security number, I would say a national identification number for immigrants or something like that. It will be dealing with everything, your taxes and pensions. Everyone will be asking for national insurance number, just identification number that you'll be getting in UK. So what happens is that it will either be on your BRP, or otherwise you have to request a new national insurance number, just because everyone is going to ask your national insurance number over here. So what happened with me, my personal experience was that my visa was like 5 months and about 26 days. So it was like not exactly 6 months. So I was just told after 2 months of just requesting my BRP that I would not be getting a BRP just because my visa was less than 6 months. So if you guys, I think so recently they have changed the policy that they would not be giving BRP to people who have actually visas less than 6 months. So if you guys have some issues with not collecting your BRP on time, just make a request on government.uk that you are having trouble collecting your BRP, and they just might give an answer that probably if you're gonna get a BRP for your length of visa or not. So if you're gonna get a BRP, it would obviously have your national insurance number on the backside. But in case if you do not have your BRP, you need to request a new national insurance number, and you can also request that on the government.uk website, and you just apply for an application, and then you get a result in like a couple of days. So that's how I actually got my national insurance number, just because I did not get my BRP. Okay, so what is HMRC and how do we like deal with it? So HMRC is basically the department that has revenue and collections and deals with all your taxes, and I guess so it also deals with your pension as well. But pension and national insurance number is really fixed, and you can't do anything about it. But what you need to do that you really would be concerned about is your taxes. So it deals with your taxes, and like I've told before, you guys gonna have emergency tax code in the first place, which is a temporary tax code. So you guys just can call HMRC by just going on the website, and they'll give you a number. And probably it takes some time for them to respond, just because they're so busy. So just expect them to answer your call in 15 minutes or 20 minutes or sometimes up to an hour. Just call them, and they'll be asking you national insurance number in the first place. So if you have that on a BRP, that could be good. But if you don't have a national insurance number, I don't think so that they're gonna help you much. So I would say that if you don't have a BRP, just go for national insurance number first, and then call HMRC, just because they know that what your national insurance number is, and they can just simply go to your link and see how much tax have you paid so far and how much tax you need to pay in the future. So obviously you're gonna be overtaxed in the very first month. That's because you're gonna have an emergency tax code, and that's like about 25%, I think so, instead of 20%. So you're like somehow overtaxed just a bit. So just call HMRC and tell them that like you want a refund just because you've been overtaxed the last year. So even if you do not, somehow HMRC is gonna do it all them by themselves over the year. They just analyze everything and see if you have been undertaxed or overtaxed, and obviously you're gonna get a form by the end of the year, just like at the annual tax return, and everything will be dealt with on their own. But if you're concerned that you want your tax code being done right at the very same time, you can just call them and let them know. Okay. Can I please have the next slide? Yeah. So what are the monthly expenses and how much can you save over a month? So as you can see, there are only two options. Either you want to save money or you do not want to save money. Okay, so if you want to save money, residence would cost you about 500 to 800 pounds a month, depending on where you live. Obviously, like if you're gonna stay in London or probably in bigger cities, they're gonna cost you a lot of money, more than 1,200 pounds probably a month, exclusive of tax and of bills as well. It all depends on grocery as well. Grocery would roughly be around 200 pounds, I would say. Depends on what you like, what you don't want to eat. Bills would be around 200 pounds. Obviously, if you're gonna be very considerate with electricity and gas usage. Commuting to work, it all depends. Either you're driving your car to work or just going on bus, or like either you're walking to your hospital or coming back. So I would say like just give a rough idea of 50 to 100 pounds. And miscellaneous would be like simple things that just pop over time. So it would be just say it's going to be 100 pounds. So total expenses per month would be somewhere around 1,000 to 1,500 pounds, I would say. And that's nominal. So you'll be saving around 1,600 pounds a month, just because an average salary would be around 2,800 pounds to 2,900 pounds. So if you just take 1,200 pounds out of that, you'll be getting 1,600 pounds a month. And I think so that's very considerable money to take back home as a saving. The other option is you don't want to say, obviously, simple maths, 2,800 minus 2,800, that's 0 pounds. So you're not going to get any savings in that case. That all depends on you. Okay, yeah. So how are you going to go to work? So we have three options. Either you're going to walk to the hospital just because it's so easy to go to the hospital. It's like 15 minutes walk, 20 minutes walk, or if you're lucky enough to just, get hospital accommodation, it's going to be just a couple of minutes away. So I think so I would would actually recommend you guys to actually see for a location that is actually very close to the hospital, just because it's really busy. It's really difficult to get bus every day or travel by car, but not everyone can actually have an accommodation very close to the hospital. So it's either it could be walking distance, or otherwise you just have to take a conveyance. The conveyance could be either a bus or a car. So by bus, I would say that if you just manage to get one bus to the hospital and just one bus back, it's going to be much easier than if you have to change one bus in middle, just because it's going to take a lot of time. I personally, for the past 2 months, I've been traveling one bus, and I used to change one bus in middle, and it took me like more than an hour to go to work. But everyone who's going to come here is going to struggle in the very first place. Not many people can have a hospital, an accommodation somewhere nearby, or a car in the very first place. So most of us are actually going to travel by bus, and still like try to be as close to the hospital as possible, just because you don't want to get late early in the morning or whenever you want to go to work. So by bus is one of the options as well. You can just simply have you know a monthly pass. It would save you money. Lastly, if you want that, if you're really troubled by the bus and you just want to shift to car, so I would say that there are a couple of things that you need to know before you actually get to buy your own car over here. So most people over here do actually buy, the people who actually come here in the first place are, you can buy a new car anywhere anyway. In the first place, who actually people do go for an old car, a used car. There are multiple platforms where you can actually look for the used cars, and auto traders is one of them, and you can also go for Facebook Marketplace and things like that. So obviously, some people would have an idea what to look into a car and how to see if the car is working fine. So that all depends on how much experience you have with the old cars. So just look for places where you can actually get a car. You can actually drive on international license for 1 whole year, since from the day you actually land in UK to the very same day the next year. So you can actually apply for your international license, and you can actually apply for insurance as well on your international license. Uh, and this is going to be 1 year. And in the meantime, you actually have to, get your UK provisional license, and then give a theory test, and then a practical test, and then get UK permanent driving license before you actually can be very good. Okay, so the next part would be settling in hospital. So settling in hospital, the first day you move in, you're obviously going to have your shadowing period, just because most of the times it's decided by the trust to actually give you some time to get to acclimatize to how everything works over here. So what actually is shadowing period? Also, and you will be obviously having some problems with the IT system and expectations. The key roles are some things that I will be discussing in the next slides with you. Okay, so what is shadowing period? Shadowing period is actually a period the most trusts do offer from about 2 weeks to 4 weeks, depending. It is a period in which actually you are, just you try to be with the consultants, with your fellow colleagues, FI2s, the people who are actually working at your post, just to see how they're working, what needs to be done, how the ward round goes, what are your duties, just like everything that you need to do in that very post is other things that actually just go for that in shadowing period. And obviously people are gonna tell you what to do and what not to do. So how to make most out of it? I would say that I had a shadowing period for like 2 weeks, and I couldn't make most out of it, just because in the shadowing period you are actually not allowed to do each and everything, just because you have some restrictions, checking the patients or taking bloods, or like do whatsoever you want to do, but you still have some restrictions. You are just basically doing a clinical attachment or an observation, I would say. So like just try to make most out of it, just as you think it's appropriate. Just probably just ask one of your colleagues to let into the system, just to know how things work, because most of the people who actually are coming from as an IMGs are mostly dealing with paperwork, and it's not really easy for them to just switch to a computer and typing and stuff like that. So I would say like just try to see like how are they doing it on the system. So, and just ask more and more questions with the seniors, with the people who are actually working with you, just to see how everything is working, so that you're very good to go the first day you actually start working. And expected duration would be like 2 weeks to 4 weeks, depending on trust. And will I be paid for the period? Yes, sometime. I think so most of the times you are actually paid for the shadowing period, but I think so that some trusts do not actually pay you for that, just because they would just simply not getting any benefit from you at the very period, and it could just simply be like a clinical attachment or observership. So you just need to make sure that if you'll be paid for that, just email your HR once you started your shadowing period that if you're going to be paid for that. And but obviously you are not going to be paid for the extra out of hours, just because the shadowing period would every day would be from 9 to 5. But still, like obviously you're going to take some money home, so that's fine. Can I have an this? Yeah. So IT system, how's different, what to expect, and what else? So IT system over here is different from where we actually come from. For example, I come from Pakistan, and in there we always had like all the paperwork. We have to take the notes on paperwork. We have to prescribe medications on paper. So in here, I would say like it is a bit advanced, and everything is actually recorded and kept safe on the IT systems. And you can actually get the information from someone. So even someone who's 80 years old, you can just simply see what happened when he was 2 years old. So it all depends. Like how good are you actually with IT systems? For example, we're gonna have Tracker, HAPMA, cardiac sheets, and stuff like that. So you guys will know once you come over here how it is different. But I would rather say that if someone is working in a private hospital in Pakistan or wherever they're working, they obviously would be having a better idea instead of if you're working in a government hospital, just because things are different over here. But I would say that once you enter the system, you'll get better over time and get more proficient. So I would say it takes about 1 month to 2 months to actually get to know where to look for what stuff, and like where to see the labs, where to put in the notes, what to do, what not to do, and how to refer the test. It will all take time, but I do understand that it's very difficult for people to actually be very good in the first place. So personal recommendation, I would say that in here you actually have to clerk a lot, which is actually you have to type in everything, even if that is a very basic thing you have to type in. So for people who are actually doing a lot of paperwork, I would say that you should actually be trying to do some typing practice, just because you have to write quite a lot of stuff. So I would say that just try to be more proficient with typing so that you can actually be good and actually type in all the notes when the patient is speaking, as compared to just miss useful information that might not be good for you. Okay. So expectations, key roles, and progression. So what's expected of you, and what you need to do, and how are you gonna progress with your job? So there are a couple of things that I would just briefly tell over here, just because these things are gonna be, also told with my. These things are also gonna be presented by Hira Shaheen once I'm done. So obviously they're hiring you, they want a doctor as a junior doctor, as a junior level, so they're gonna expect some basic things from you that mostly deals with ABCD approach. And I do assume that most of you people who are actually just going to start NHS have passed their lab examination, and their GMC must just be underway. So as you all know, ABCD approach just deals with the basics like airway, breathing, circulation, disability, and exposure, and everyone knows how that goes. So that's the basic thing that makes you a safe doctor. For example, even if you are approaching a sick patient, you do know that what needs to be done in the very first place when you're all alone, that you need to make sure that the patient at least has good vitals, and is does you buy some time to the patient even before the help arrives. Okay, so moving on to the next point, know when to escalate. Most of the times when you actually start over here, although you might have seen a lot of patients back in your country, but things over here might be a little bit different. I don't know how much support people get back in their countries, but over here you get a lot of support. So even if 1% you're not sure about anything, I would rather say that you should escalate it to your registrar in the very first place, even if you're unsure, just because it's better safe than sorry. And most of the trust over here to actually expect you to ask and ask and ask and ask, just to make sure that patients are safe. Dress code, I would say most of people over here just go for the scrubs, and I don't think so that I'm not sure about medicine, but in pediatrics we just wear scrubs. And engaging, you should actually be very very engaging with your fellow colleagues and your consultants and your line manager or anyone else. Engaging would simply cover everything. That means that you need to communicate a lot with everyone just to see how things goes in the very first months. You'll be learning a lot, so you need to engage a lot to actually get to know the entire system, and it's going to help you a lot. Obviously, you're gonna be good in taking history and devising initial management plan. They're not gonna expect you to be professional, to be to consultant stuff or even registrar stuff, but they do expect you to at least give a basic history and just to see how are you gonna manage a patient in case if any place you don't have senior support. So you should be a safe doctor and you know how to do initial management. Just take history, get an initial management plan, and talk to your senior and just tell them that I'm thinking that this patient has this thing going on, and I would go for these investigations, and I would like to manage this patient this way. So what's your thought about it? Like, are you happy for me to go with that? Just discuss with your senior. And help from the trust. Sometimes trust actually reimburse some funds once you are moving from your own country, or once you are like moving somewhere in between cities in UK, or sometimes if you're gonna do some training courses, some education training courses, the trust is gonna pay you some money, a couple of £100, probably be a year. It is also mentioned on your contract that if you are eligible for any reimbursement over the 6 months or 12 months of contract or not. So just look out for it. Importance of trust core values. Trust core values, as some of you might have known, that are actually a couple of words like excellence, integrity, respect, treating patients, or stuff like that. These are basically actually values our trust hold, and it means that these are the values. These are things that actually trust actually has a lot of emphasis upon. So whichsoever trust you're gonna join, just make sure that you try to comply with all the values, and it will be actually be an asset to you. And lastly, a couple of things that will be beneficial for you in progression are clinical audits and searches, just because many people out from UK do not have many opportunity to go for audits and researches. So in here, I would say that we have an ample opportunity, and once you get settled in, like after a couple of months, you should try to indulge in one of these things just to put on your CV and just try to get into training next year or whenever you feel appropriate. So I've covered briefly everything over here as well. So I'm just gonna switch over to my fellow colleague here, Shaheen, and she's gonna take her from here. And okay.
Hello, everyone. I hope you guys can hear me.
Yes, we can.
Hi, yeah, we can.
My name is Hira Shaheen, and I'm working as a clinical development fellow in NHS Starter in Arran. It's kind of a part of area in Scotland. It's 1 hour away from Glasgow and considered a rural side of Scotland. I have been working since January, and so I'm relatively new. And I think there are a lot of things that I have observed during my stay here. And a lot of that has been covered by Hamza, and I think it has been covered very elaborately. So before I start, my portion is to talk about the soft skills. From what I have observed, we have a lot of support and information available about how to get bank account opened or how to sort out accommodation, and there are a lot of things that Hamza has covered as well. But I think there are a few things that are not very talked about, and that are the soft skills. They're like in every job we go. If you talk to any professional and if you look at their CVs, they always have some soft skills to offer. Like, for example, they are team worker. They have skills to offer as like they have leadership skills. They have these skills, those skills. But as doctors, unfortunately, we don't really focus on that, because most of the time you're just very busy doing the hardcore stuff. And IMGs coming into NHS, I think they struggle a lot of times because they have not been prepared and they're not expecting those things. Because let's be frank, it's a cultural shock. Wherever you have worked previously, this is a new system, and initially things can be very overwhelming. As Hamza has talked about multiple things, you have to deal with multiple things in your first month. And I think your first month is probably the most crucial month in NHS, because you're settling down in a new country, you're settling down in a new system, you don't know a lot of people. So that takes a mental toll on you. You're leaving your families behind. It's just something that is challenging, and that does reflect in your work as well. So I think it's very important to have the right kind of mindset and be mentally prepared for whatever is coming like in front of you. And having said that, I don't want to portray that it's very difficult or it's very challenging and it's all just a big pile of sadness that you're going to come across. There are so many things that you are going to enjoy if you have the right kind of attitude when you are coming in NHS. So I'm going to cover that in my first portion of this talk, that when you're coming in NHS, you are the outsider, although NHS never discriminates. Yes, there are good and bad people working in every working environment, but this is the country, and at least this has my experience, or this has been my experience in previous 6 months, that they don't discriminate you. They are mostly welcoming. But of course, there are good people and there are bad people everywhere. That could be same for our home countries as well. But I think it's very important to have the right mindset. You have to be very open-minded and you have to be very open to learning new things and acknowledging your situation, that it's a new country, it's a new system. You will have challenges and you will have a lot of things to figure out, but it's not something that is impossible. And there are so many people who have done this before, and any mistake that you make or anything you don't know, it doesn't define you, or it doesn't mean that you're incapable of doing something. It's just something that you have to figure out. And I think if you have a half glass full approach, it's just better, because every time you do get overwhelmed, every time you can't figure out something, if you sit down with yourself and if you look back and see how far you have come, that really helps. Initially, I remember when I came here, even sorting out the bins, they were quite overwhelming. There are so many bins and there are so many ways they recycle. The waste management in this country is different from our home country. So it took me a lot of time for just sorting the bins out. And I was like, I can't even sort that out. It's just a small thing, but it's not. It's new. So like every skill or every new thing that you learn in medicine, starting in a new country is also like a skill. You have to understand that it will take time. And I want to reassure you that if you do give it time, you do get it does get easier with every day. One thing that I noticed in IMGs coming, and I don't think a lot of people have the insight in that, and it's very negative, is victim mentality. If you're coming here, you have to be a fighter. You can't just sit and say, oh, that person didn't help me, this person has not been open to me. You have to make way for yourself. And I would say it's really difficult because you do get a lot of support here, but it has to be an active effort from you. You do need to put in work every day to achieve what you are going to achieve. One thing that initially I struggled with was managing the expectations. Sometimes coming from the home country, we are either not very clinically sound because we don't have the kind of experience or exposure that FY2 levels get here. And that puts us in a lot of difficult situations in a way where we start judging ourselves. We fight with imposter syndrome. I think it's very important to have the insight of expectations. What a hospital expects from you. What should be your expectations from yourself. And I'm saying this because I didn't get a proper shadowing period. This was a shame because I should have. because it's very important to have a shadowing period. You should know what are your roles and responsibilities, and only a shadowing period can tell you that. But I couldn't get it because my consultant was not informed in time. There was some miscommunication with HR. So I was just given 2 to 3 days of shadowing, and then I was thrown in to take care of a ward. Although everybody was very happy, and if I had asked something, if I want help, they will give me a hand. But I was the only IMG in my ward, so a lot of them didn't know what I need help with. So on the third day, I took over the ward, and I thought I was doing fine. But 2 days later, the head nurse literally sat me down, and they're like, "Do you have a plan when you come over in the morning?" And this was my 5th day in the hospital. And I was literally looking at her, and I thought I would start crying because I felt interrogated. Then I was honest with her that I don't think I don't think I know what is expected of me. So she said that you have not been prescribing insulins for past 3 days, and we need that. We need you to do that. So I could take it personally, and I could say that, oh, she's being hostile to me. I'm an IMG. Maybe she's just low-key racist. But instead of doing that, I actually asked her, and I opened up and I said, I'm really sorry. I didn't get the proper shadowing period, and I don't know what you guys expect me to do. So she gave me a list, and she said, these are the responsibilities that we expect from a junior doctor. So if you come in the morning, you should be prepared to do these things. So I think it's very important, if you ever are in a situation like this, where you feel that you have not been helped, or you don't get a proper shadowing period, or even any other difficult situation where somebody from the team comes and talks to you and asks you, you don't have to take it personally. I think honesty goes a long way. If you just tell them what you think and what were your intentions, I think they will be always ready to help you. So you have to understand what is expected of you, what is your job description like, and what are the limitations of your job. Another area where I struggled was that I did not know what is the limitation of my job. For example, there was a time when I did not have a consultant on ward, and the kind of team I worked with, we don't have a registrar. So it's just an FY2 and a consultant. So the consultant was, out of sight, and he had gone home, and we had a sick patient. And I was the only FY2, and I managed that situation, but I had to hand it over to the night team. So what happened was the patient did not have a treatment escalation plan in place, which means that treatment escalation plan is basically a framework that medical team that is given to medical team, and that helps medical team navigate how much are we going to do for that patient. Are we going to do that? Are we going to put that patient in ITU if they are unwell? Or we are just going to do ward level care? It's something that is done in UK. And that patient did not have a form, and he was very elderly, and a lot of times elderly patients, we don't actively intervene. And night team wanted me to have a treatment escalation plan in place at least, because I was the one who was handing over that patient. But I didn't know. It was only 2 weeks into NHS, and I didn't know how to make that judgment that if a patient is for ITU or not, or if the patient is for CPR or not. So it was a difficult situation, and I actually grilled myself for like a week. That why didn't I know how to make that judgment? Although I asked my colleague to help, and we came up with a step that was like treatment escalation plan that was appropriate for the patient, but I just didn't know, and I kept judging myself and grilling myself that I didn't know this simple thing. But when I talked to my educational supervisor, he told me that it was not my responsibility to decide what the ceiling of care was. It was actually a consultant's responsibility, and it was unfortunate that the consultant was not available there. Or this plan can be made by a registrar or senior level. We don't expect FY2s to make a call on CPR or make a call on how much treatment a patient should be given based on their comorbidities or their medical conditions. So the idea of narrating this example is that you need to know what are the limitations of your job. Because if you don't know and you keep judging yourself or keep becoming anxious over something that you're not even responsible of, that is not good for your mental health initially starting. Now that I have worked in NHS for 6 months, I know what is expected of me. and what are my limitations, where is the role of senior, and where I have to go if I don't know something. I think I'm in much better mental place to be. So I think it's very important to talk to your colleagues, talk to people at your level, talk to IMGs who have been through this. If you're confused about what the responsibilities you have and what are the expectations that a team has from you, that gives you a lot of peace of mind, and that saves you a lot of anxiety when you're starting, because things are already quite overwhelming when you start. So that's how you manage expectations. But having said that, you need to have an open mind, and you need to keep learning, keep asking questions if you don't know anything, instead of just waiting for the people to come to you and tell you something, because that's probably not very healthy. If you ask something before somebody comes and points out your mistake, it's just a better approach, and I think it just leaves you in a much positive mindset when you're starting. So that's the right mindset to have. Can we move to the next slide, please? Okay. One thing I want to talk about is dealing with mistakes. I think I'm not sure how it works in other countries, but back home in Pakistan, it's not very healthy working environment in a lot of places, where your mistakes are actually the things that they use to penalize against you. You may have experiences where the consultant would get personal, where they would insult you and stuff like that. But here, in most trusts, and trusts that are worth working in, the environment is quite supportive, and they understand in NHS that mistakes are bound to happen. It's a human limitation that we have to make our peace with. So we don't. There's a healthy environment to deal with mistakes, and I think you should have that idea before you work in NHS, or while working in NHS, especially when you're new, that it's okay to make mistakes as far as you're not making them intentionally. And even if you do make mistake, there is a better way to deal with it, instead of blame culture, instead of blaming yourself, and like, for example, blaming your colleagues. It's just easier to just apologize and offer to rectify. If somebody says that you have prescribed gentamicin dose wrong, you don't have to take it personally. You don't have to grill or judge yourself that, oh, I don't even know that. And you don't have to think that what other person would think of you. That should be least of your worries. You have to look at it like something that you didn't know, or maybe you made a mistake, but okay, what can you do about it now? And it's always easy. Like, sorry is a word that probably will save you from a lot of complicated situations. And you shouldn't be very reluctant to say sorry. Even if it is not your mistake, it's okay to just say, sorry, I didn't know. Or sorry, I'm new to this system. And I think it's a very good card to have. You have to keep playing it until you're confident in a system. Just tell them, I'm so sorry, I'm new. And it's not something that only you will be doing. While you are working in NHS, you will see that people have very specialized roles. Here, they compartmentalize things in a very good way. If a consultant is working in geriatrics and he deals the geriatrics or care of elderly general medicine, he won't know anything about end of life care. And it's very normal for a consultant, even though we think that consultant is the most senior person, but it's okay. If you ask a question from a consultant who is dealing with general medicine, but you ask them a question of end of life, they will just say, sorry, I don't know. Or sorry, maybe I have made a mistake. That is how NHS works. It is not about the egos that, okay, you don't know this. It's just about how to deal with a situation and what are the human limitations. What are the things that a person can know? You can only remember enough, or you can only know enough. You can't know everything. So if you do make a mistake, or if you don't know anything, it's just very easy to say that, I'm sorry, I don't know this. Could you help me do that? And if you have made a mistake, just rectify that. Offer to rectify that. Okay, I have done this. I'm so sorry, I didn't know. This is, I think, how can I rectify? Or you can tell me, how can I rectify this? And then just reflect on it. And that brings me to my second point, judgment versus reflection. Reflection is something very common in NHS. You will come across this term very often when you're working in NHS because it's part of our portfolio that every day, everything that you do, if you learn something new, if you make a mistake and you figure out that, okay, I did something wrong, or if you didn't follow a guideline and then you find out that, okay, this is not the way it is done, you just have to reflect on it, that what did you learn from that? How can this thing change your practice in future? And what do you need to do to make sure that you don't make this mistake again? Maybe you need to do some reading, maybe you need to watch some YouTube video. So this is how you deal with it. Instead of just blaming your colleague, blaming yourself, blaming the system, blaming NHS, blaming UK, blaming GMC for penalizing you or setting a big accountability. So you have to be in the right mindset that, okay, it's a new system. There will be a lot of things that I won't know. And there was something that happened at my workplace. My consultant, I was working in a end-of-life care ward, and in end-of-life care ward, we often use syringe drivers where we constantly give patient an opioid medication to relieve pain and to keep him comfortable. So I didn't know the dosage, and I opened up Scottish palliative care guidelines to see what dosage it was. And in that, they said that seek specialist care. So they didn't have a dosage for me. And they asked me to just talk to my consultant. So I just paged my consultant and I asked her that I need this dosage to be figured out. And the consultant came to the ward and said, okay, let me figure that out. And when I went to see how that is being figured out, the consultant was literally looking at the same guidelines that I was looking. So, and there was a very funny incident for me because I was thinking, oh my God, the consultant will think I don't even know that. But the consultant didn't know as himself. And it has nothing to do with her lack of knowledge or consultant's efficiency. It's just a limitation, or it's just a system that is designed on the concept that humans do have limitations and they don't know everything. They cannot know everything. So they have a system in place that will tell you what to do in what situation. So I think you just have to reflect on that. If I didn't know the dosage, I went to the consultant. The consultant didn't know the dose. She figured it out. Then she told me, and I just reflected on that. Okay, this is how I will do it next time. So I think this is a very positive mindset to have. And if you have that, you will probably make your life much more easier while starting in NHS. But if you just keep grilling yourself on every small mistake that you do, it will be very difficult for you initially, at least. There is a concept called datics. When you're working in NHS, you might come across this term. Datics is actually a record that you keep if there is an incident. For example, if you have prescribed a gentamicin dose that was wrong, maybe you didn't put the weight of the patient right, maybe you didn't put the creatinine levels of the patient right. So you calculate the dose, but the dose calculation was wrong, or maybe you calculated the time of dose wrong. Somebody else saw that and pointed it out. So they then fill the datics to record that, okay, the dose was recorded wrong and patient got a higher dose. So it's kind of a record of a situation. The datics I had to do in these 6 months was my needle stick injury. I got a needle stick injury and I had to do the datics. So it was kind of a event reporting. And if you are being datixed, for example, a colleague found your mistake and he datixed you, you will probably be getting an email about that, okay, this is what you have done. This is the error that was done by you. I won't worry about datix, but it's natural that some people do worry. And sometimes the datix does get a negative connotation because colleagues don't like to be datixed by their other colleagues, because it is like escalating the situation to supervisor and not dealing it with between the colleagues. But if the datix does anything, it's just pushes you to do better. The GMC does not penalize you for having a datix. The trust doesn't play it against you unless it's something that compromised patient safety. So if you do come across datix in your job, I wouldn't worry, and I would probably go to my educational supervisor, where the educational supervisor's role come in. Talk to them. Okay, I got dayticks. This was the incident. This is my takeaway from the incidents, and I am going to reflect on it. This is how I can rectify it. And there are situations that you can deal with, and I think your education supervisor can help you navigate through it. So it's just event reporting. It does not mean that you're being grilled for something or you're being penalized for something. Then complaints. There will be, my educational supervisor says that complaints is the wrong word. It should be service provision suggestions that should be used, because sometimes the patients complain, the patient attendants can complain, maybe the nurses can complain, but that only shows something that was a lapse of judgment on your part. And I'm sure there are a lot of helping outlets available, and depending on the severity of complaint, you can manage with it. So the idea is to avoid complaints by staying safe, escalating in proper manner, and making sure that the team you're working with knows what you're doing, and you are effectively communicating everything between all the members of the team, because UK has a very multidisciplinary system, and there are a lot of people working with you: nurses, physiotherapists, occupational health managers, social workers, radiologists, pharmacists. So you're working with a whole team, and you need to make sure that you're communicating effectively with all the members, and you're covering all the bases that need to be covered. If you're safe, I think it shouldn't be a problem. And while we're talking about it, I would say if you're working in UK, it's better to have an indemnity insurance in place, where you pay a small fee to a company every month, and they give you legal advice when you need it. Usually, the malpractice insurance is covered by trust, and all doctors are covered by Crown in UK, and we don't have to pay for malpractice insurance. But it's better to have indemnity insurance in place, so that if you do get in trouble, there is a legal body that is on your side, and you have an independent opinion coming from there to help sort you out. So if there are challenges, there's always support available. That's the take-home lesson from this. Okay. Finding support. I think it's very important to prepare yourself. How are you going to find support? What are the outlets that can help you? When you're new and you're coming in a new system, it's your job to build rapport first. You need to have an idea that you need to do your job responsibly. And between your colleagues, you should be the person who's taking initiative. If you are free and you don't have, you're done with your own jobs and you have some time, you can always help, or like other colleagues, or just ask them if they need a hand. If you see a colleague struggling, you can ask them if I can give you a hand. And it doesn't always have to be a doctor. It can be a nurse. It can be a clinical care worker. I have offered help to clinical care workers who were struggling with cannulas. I have offered help to clerks who were struggling with finding patient notes and assembling them, just because I had a moment on my hand. You have to do your own work first, and then if you think you have time to deal with it, offer help and create a positive environment around you, and be the colleague that you want to work with. So that this rapport building will help you have a social circle and have a support in place at work as well. If you're good to people, they will always try to help you when you get in trouble or when you need help. And initially, I think it's very important to ask questions. Because sometimes when we are coming from home countries, or even if we are switching jobs between NHS and going to a new trust, it's very natural to think that if I ask questions, somebody will judge me. And that fear of judgment should be managed. And I would say that initially, at least initially, you should keep that fear of judgment aside. If people are thinking bad of you, let them do that. Just ask questions, because that is what is important. That makes you a safe doctor. You have to keep reassuring yourself that you're here to be a safe doctor, a good doctor, and you're not here to please people. And there will always be people who don't like you, or who judge you, or who have opinions about you. but your job is to do your job safely. So ask questions and always confirm. If you're not sure, if you have doubt, always ask before you do something, because that's the safe thing to do. And here, most of the time, if you're asking questions, nobody judges you. It's very common in this culture to ask even silly questions, because that makes you a safe doctor, they think. At the end of the day, in finding support, I think you have to have right resources in your hand. I always say it's not very difficult to work in NHS if you don't know anything, because they have a very good system in place. You don't have to know everything. You just have to know where to go if you're stuck somewhere. There's so many NHS apps that you can find handy. If you're struggling with something basic like fluid assessment, you can go to BritakMedics. If you have to find some trust guidelines, what antibiotic to start, how many, what is the doses that you need to give. There's always a trust guideline page that is available, and you can ask your colleague what is the app that they use. Download that app, and if the patient is sick, you can just go onto that app and see what management your trust says and ask you to follow, and just follow that. There is a very good app I have found very handy. It's GGC Medics. It's by Glasgow and Clyde Trust, and they have like very elaborately covered all the medical topics, like how to deal with atrial fibrillation, how to deal with chest pain, and they have different, flow charts that help you go into that direction. So you don't have to keep asking questions if you're clinically struggling. You just have to find the right resource, and if you think you have searched them and you couldn't find anything, then you can always ask your colleague, discuss with your other FY2s or people your level before going to senior, because it's always better to have a plan in your own mind and then go to seniors and let them correct you or let them add things that you have missed, instead of just going blindly and asking them, okay, the patient is sick, this is happening, that is happening, I don't know what to do. That affects your credibility. They expect you to be a complete doctor at this level, and they expect you to have a plan in place. Even if that plan is not covering anything, everything, that's okay. If that plan is missing out things, that's all right. But they need you to have your own opinion before you can escalate it to your seniors, and at least have some ideas before you go to your seniors. Then it's one thing that I have found very handy in my practice is learn from patients' plans. If a patient comes to you and you're reviewing him, it's always better to, look into notes. The approach here is to have a complete idea of past medical history, of all that has been done to the patient during that episode of admission, to make your own judgment that what is going on. And while you're doing that, you can read plans that other doctors have made. That from there you can pick things that they did. Like, for example, if a patient was in pain and he was already on basic painkiller medications, just look at what other doctors did, what they prescribed, what was their rationale, and it will give you a lot of clues and ideas on how to deal with that situation if you are in that situation. I have learned a lot from how other doctors write their notes, how other doctors manage a particular condition in patient. So that's always helpful to just skim through the notes and see what has happened to the patient, how other people have dealt them. You can also have a foundation book, Oxford Medicine for Foundation Doctors. It's a very good book. It deals with the conditions that we come across on daily basis in the way a foundation doctor is expected to deal with that situation. So it's really helpful to have that book so that you can just open it up and see if there's anything you're missing out. So do some digging and make your own plan. Use your common sense, your knowledge. We all are capable of doing that at this level. And then if you are confused, if you are not sure, either just ask senior to go through your plan, or just ask them, I have made this plan. I just want to run it by you to see if I'm doing everything that I can. And the senior will be happy to help you, instead of just you going there cluelessly and giving them random information, and the senior will be annoyed that you have to do your part first. The next thing that I have seen IMG struggling is communication. I think it's a different system here. As I said, it's very multidisciplinary. Every part, every member of the team has a role, and you have to understand that you are part of the team, and you are there to play your role. You are not the leader, and you're not everything in that team. You're just there as a part of team, and everyone's say, everyone's concerns are equally important. You guys might have seen a lot of posts in IMG groups about nurses, and that nurses do this, nurses do that. This is an nurses run NHS, and I don't agree with that approach because, in my opinion, nurses have their own role. We can't expect them to do the jobs they're not trained to do, and most of the time they're just very busy. Everyone is overburdened in NHS, and that doesn't mean NHS is a bad place to work. It just means everyone is trying to do their own job. And if you are overworked, or if you have a lot more patients that you can carry, you need to raise voice instead of blaming it on nurses or saying that, okay, they're not helping me, or that person is not helping me. Their job is different from yours, and they're trying to do that. So always be empathetic before you make a judgment and come up with something that would just affect your mental health, and that would just affect your working environment and your spirit. So it's just a different culture, and it's a different place to work in. You will be working with a lot of people who are coming from different cultures. They have their different cultural sensibilities, different cultural sensitivities. So it's always a good idea to be open and give benefit of doubt to people instead of just go into a victim mentality and saying that, okay, things are wrong with me. You're a part of a big system, and you have to understand that people are struggling, people are trying to do their best. This is what I have learned from my Scottish colleagues. I think they're very nice people, and they always assume, if you're not doing something well, they always assume that maybe you have something else to do. Or if you have started something that the patient doesn't need, for example, a medication, they will always think, okay, maybe when she started it, the patient did need it, and now the condition has resolved. So it's something that you give benefit of doubt to people, and you keep a good faith. Unless you see a person who is not safe for a patient and you think it should be raised, you go to the senior and discuss that. So communicate well. Don't think that nurses are not your equals, or that nurses are something like someone who have to work like under you. They're just part of the team. So if you deal that tactfully, if you say thank you, if you say sorry, I think you're doing well. And that also helps you deal with difficult people. You have to pick your battles wisely, and before making everything a big trouble for yourself. Next slide, please. I think building a social life is very important. It's a new country. A lot of people don't have families here, and they don't have a lot of friends here. Even if they do, they're in different countries, different cities. So a lot of IMGs struggle with building a social life here, and I think that's a very important part to talk about if we talk about the first month in NHS. If you know, some people, I won't say that everyone needs to be extrovert to make a group of friends, but this is also part of an active effort. You're coming here, you're figuring out your national insurance number, you're figuring out your bank accounts, you're figuring out accommodation, your commute, everything is going side by side. And you're doing that because you're supposed to do that. But sometimes we just don't realize that social life is also a very important part. And social life should be figured out as you're figuring out your national insurance number or your bank account. So you have to have some strategies on how to get support, how to build a social life. And I think it's very important to break ice. You can't expect people to understand that you need friends. You have to make effort yourself. We are coming in a new country. A lot of people don't know your struggle. They don't know your cultural backgrounds. They don't even know what is appropriate to talk when they are talking to you. So I think it's very important that you break the ice. When I started in NHS, I was the only IMG and only Pakistani or only South Asian, I would say. All my other colleagues were from Scotland or were from England. And initially, I thought that maybe I'll have trouble. But trust me, if you talk to them, if you make them a part of your team before they make you a part of your team, it will be much better. You just take initiatives. I remember they helped me when I was new, and they just said that every time I would need something, I'll just go to them, ask them questions, and then after a month, I said, "Okay, guys, you have helped me a lot, and I want to arrange a dinner for you, a thank you dinner, and we all four or five of us, we can go." And then we did go out. If you think there are some limitations, you can't eat in a certain place, it's okay. You can arrange a place that suits you as well. And most of the time, people do understand that if you don't want to drink a certain things like due to your religious differences, you can always find vegetarian options. You can always find non-alcoholic options. But try to build our social life without thinking or without expecting other people to do that for you. Secondly, considering that there are shortage of doctors everywhere in UK, there are always IMDs working in your trust. It's better to look for them. You can call you can ask your HR or ask your line manager if there is an IMG group in your trust. If there is no IMG group, you can make one. Just reach out to all the IMGs that you can see or you can work with. You have worked with during your own calls or during your interaction. Just make a group yourself. Take initiatives, and it doesn't have to be very big group or big thing. Small things. If even if you can find one friend who understands your struggles, I think that really helps a lot. But break the ice. Take initiatives, and make hobbies outside work. This country is just not about NHS. There are so many things you can do, especially in summer. I mean, yes, I know winters are very depressing sometimes, and you're bound inside your home most of the time because it's dark outside, it's cold outside. But there are still things that you can do outside work to give you a lot of mental health support that you need initially. Last thing I want to discuss is working in Scotland. I've come across so many IMGs who have concerned, or who are concerned about Scotland because they think, well, honestly, most of times people coming from South Asia or any other country, they just don't know Scotland is part of UK. Most of the time, we just think London is a big UK, and that is it. But Scotland is part of four countries, that are part of UK. We have Northern Ireland, we have Scotland, we have Wales, and we have England. So I didn't know about Scotland much. I just had heard about Glasgow as a far off city that I will probably never go. But when I came to UK for my PLAB 2, I had some cousins. I had a family in Glasgow and I went there for the first time. I did my clinical attachment in the same trust now that I'm working with, and it was a very pleasant surprise for me because I didn't know Scotland the way Scotland is, portrayed. It's just it does not have an existence in an IMG's mind, I would say. But it's very nice experience, and some important points and some misconceptions that need to be addressed are NHS Scotland versus NHS England. Now, what happens is Scotland has its own government, but it's still under UK. So NHS Scotland is an entirely different body. It is run the same way that NHS England is run, but they are allowed to manage their own funds because Scotland has their own Prime Minister, who is called First Minister, and they manage their money in their own way. And surprisingly, NHS Scotland is much better funded than NHS England, which is a political discussion that we probably don't have time to discuss. But I find NHS Scotland much better funded in a way that they work for their people a lot more. they put a lot of work in their community work. So that gives doctors a lot of space. And I think they do need doctors. They are very friendly people. And there are so many things that NHS England is currently suffering with. Like there are challenges that NHS England is facing, but NHS Scotland is slightly better in them because they just fund it slightly more. So it's not very different. If you are working in NHS Scotland, you can still find a job in NHS England because it's all one body with two different, I would say, subsections. So if you ask me in one answer, do I recommend working in Scotland? Yes, I absolutely do. And some people think that living in Scotland does not count as a period in your ILR. That's totally untrue. You're granted a visa for UK, and Scotland is a part of UK. There are some concerns about language and accents. Yes, UK has variety of accents, and if you're living in Scotland, the accent is slightly thicker. And as you move towards the northern side of Scotland, it keeps getting thicker. But I would say give it a month, and you can totally understand that. You do pick up a lot of phrases from that as well. It's just like another challenge that you come to a new country and it takes some time for you to pick up the accent, and initially you probably won't be able to understand a lot of it, but you can always ask, and these people are always very nice and always helping. Working environment, sometimes people ask me that Scotland does not have a lot of IMGs. That is not true. Especially the bigger cities, for example, Glasgow and Edinburgh have a very big population of ethnic minorities. Glasgow, after English or Scottish minority, Pakistanis are the biggest ethnic minority in Glasgow. So you do get a lot of IMGs if you look for them. You do get a lot of food options. Everything that an IMG needs to survive, Glasgow will have that. One thing that bothers people about Scotland or North in general is weather. Yes, winters are very cold, but I think that gets compensated by how warm the people are. They are friendly, they're nice, and I think it's generally a very nice place to work. As a country, it's beautiful. The living conditions, like the living cost is cheaper as compared to other parts of UK. So I would totally recommend that people coming here, and if you are getting a job in Scotland, especially if it is your first NHS job, there should be no hesitation at all. And you shouldn't hesitate just because it's Scotland and it's not England. You can always come here, and while we're talking about that, if you secure your first job in Scotland and you don't like it, or you just want to move south because all your friends are there, you can just work for a few months and then start applying in like England side. And once you have an NHS experience, it's just very easy, and the whole UK becomes open to you. You can get a job anywhere. And for example, I just worked here for 6 months, and then I wanted to move to London because of some personal issues, and I applied to one job and I got it. Now, it doesn't mean that you will be you will be getting every job that you apply to, but it's just become quite easy. And even though people say that London is competitive, I didn't have a lot of trouble doing that because I had NHS experience. So if you get your first job in Scotland, you shouldn't hesitate to accept it. And you may even end up loving it. I still like Scotland, and low-key I'm dreading going to London because there are so many things that Nord gives you. They are more accommodating, people are friendlier, they understand you well, they give you a lot of space that you may not be able to find in bigger cities or in of England. So my experience of working in Scotland has been very good. So I totally recommend that. And yes, living in Scotland counts in your citizenship period because it's part of UK. So I think that's probably all from my side. If you guys have any questions, do let me know.
I think so. Hira has been so thorough with everything. I wasn't even expecting that much from her, but she's literally have covered each and everything. So,
Sorry,
but
guys,
yes,
if it came across as a psychotherapy session, I'm so sorry. I just didn't.
Yeah, yeah. I knew it was the case.
I was saying you have convinced us all to move to Scotland.
Yeah.
And I think that's probably giving me a lot. Leave Scotland. I love Scotland. I recommend everybody to start with
It's a great place, actually. Yeah.
I'm not sure exactly been going on. Thank you so much, Hamza and Hira. That was absolutely one of the best sessions that I had, and I had so much thing to learn. Even we've joined for like now 1.5 years, but still we are really don't know anything like you guys have explained. It's really good to kind of go through all the things, and I really thank you. From both my side as well as from Bisma and Shua. I'd just like to ask Shua or Bisma if they have anything to add up, please, as well.
I think they've summed up it really well. So thank you. Thank you for your time and giving an excellent presentation. I'm sure I'd like to thank them all. They've taken the time out and they've attended the session. I'm very much hopeful. I'm expecting they would have learned a lot as we have. So all I want to say is thank you guys. Really good, very informative session. And thank you for everyone who's attended.
Thank you for giving us a chance to speak. I really loved it. I have never or anything like that. So I think you guys have taken a very good initiative because IMGs probably need all the help. When I came here, I had a lot of help. I still needed a lot of help. So I think if the kind of session that you guys are conducting, it can make it easy for newcomers in a lot of ways. They have a lot of material before they come in, and that can help them settle. So it's a really good initiative. I really love being part of it.
Yeah, same goes for me. It was my first presentation ever, and I actually have learned quite a lot of things from myself as well. Just because once you get into NHS, you need to present a lot of things, and I would rather say to all my audience that you should actually to try to participate in stuff like that, where you actually have to present things just because you need to do influence your NHS. And I also want to greatly thank you this platform for giving me an opportunity to present myself over here. And I'm really glad I was able to. Yeah.
Thank you so much. Thanks, Hira and Hamza. There was some issue with my signal, so whenever I try to speak, there is some background noise. Can you hear me clearly?
Yeah, there had been some distortion though.
Yeah, I think because I have logged in from 2 devices, so probably that's why.
Does anyone have any questions? We are happy to answer any questions. We are still waiting on the chat, or you can either talk to us live, or you can have a chat session, like whatever you want. We are still here to answer some questions if you guys like.
So from Lakmini, maybe in the meantime, you were talking about the recording of the session. So we definitely upload it on and the recording will be available. And I thank you guys, all the participants, to be very patient. And I think it must have been very useful for everyone of us, definitely. Any other questions? If not, then we will sign off.
Yeah, or any suggestions?
Or any
questions? Because I think it's missed on that initially. If you guys want to tell which stage are you? Have you already started working in NHS, or are you still looking for jobs? You want to tell us, like, what level are you guys? If you would have any suggestions on what you... And it would also be great if you guys just tell us one by one if you want to. Just like which stage of your job process are you guys are. That would be helpful as well, so that at least we know.
I think that would be enough for today. And based on okay, anyone here on Wales? All right. Good luck for that, Selani. But yeah, I think there might not be any questions. So thank you so much at the end again, Hamza and Amr, especially Hamza, Amr, and Hirashin, especially, and all the for all the work, Shuahak and Bitma. I really can't thank you enough for the efforts that you guys made. And probably it's the right time to sign off now. And see you guys next time, hopefully with some new content and some new topic, and might be something new to kind of that might help our All right.
Thank you everyone for attending.
Thank you. Thank you.
Have a good evening. Bye.
Thank you. Thanks so much.
Bye-bye.
Bye. Bye, guys. Take care.